Don't use corticosteroids. They are not indicated and can increase the risk of GI bleeding, hyperglycemia, and immunosuppression. Don't give platelet transfusions for a low platelet count always. This cannot lower the risk of severe bleeding but might lead to fluid overload and prolonged hospitalization. Don't give half normal, 0.45% saline as maintenance fluid because it leaks into third spaces and may cause worsening of ascites and pleural effusions. Don't think that only IV fluids will help. First check if the patient can take fluids orally. Use only the minimum amount of IV fluid to keep the patient well perfused. Decrease IV fluid rate as hemodynamic status improves or urine output increases. Scene script. Do tell OPD patients when to return for follow-up. Tell them about warning signs and their timing, and the critical period that can occur afterwards. Do recognize the critical period. The critical period begins and lasts for 24-48 hours. During this period, some patients may rapidly deteriorate. Do closely monitor fluid intake and output, vital signs, and hematocrit levels. Ins and outs should be measured every 12 hours, and vitals every 4 hours. Hematocrits should be measured every 6-12 hours at minimum during the critical period. Do recognize and treat early shock. Early shock, also known as compensated or normotensive shock, is characterized by narrowing pulse pressure, systolic minus diastolic BP approaching 20 mmHg, increasing heart rate, and delayed capillary refill or cool extremities. Do administer colloids, such as albumin, for refractory shock. Patients who do not respond to 2-3 boluses of isotonic saline should be given colloids instead of more saline. Do give PRBCs or whole blood for clinically significant bleeding. If hematocrit is dropping with unstable vital signs or significant bleeding is apparent, immediately transfuse blood. During the febrile phase, may last 2-7 days, and subsequent critical phase, 1-2 days, your clinic should advise patient or their family to. There are many precautions to protect against dengue. Be safe and stay away from mosquitoes in your house.